All right. I am Patrick Cawley with Keystone Elder Law, and this is Keynotes, a series of conversations about issues affecting older people, people with special needs, and veterans of the armed forces. I'm joined today by Cheryl Grier with Your Visiting Hygienist. Cheryl, thank you for joining me, and would you tell me a little bit about how you, your background, how you came to start Your Visiting Hygienist, which has a specialized focus in helping people who are unfortunately confined to healthcare settings.
Thanks, Patrick. Yes, my name, like you said, is Cheryl Grier. I'm the owner-operator of Your Visiting Hygienist. I graduated in 1985 from the University of Pittsburgh and have been a dental hygienist now for 35 years. I am an RDH, which is a registered dental hygienist. Most people know what that is. That is the person that when you go into a dental office, they clean your teeth and they yell at you for not flossing.
I was tempted to address that right off the bat. Every time I talk to a dental hygienist, I know I'm going to have to cop to missing a few days of flossing, but I'm actually doing pretty well right now. But anyway, okay. Sorry, go ahead.
Good. No, yes, that's a common subject for most people, but yes, we are always on everybody about the flossing. But I am also a PhDHP, which is a public health dental hygiene practitioner. And that is just an additional certification that the state of Pennsylvania allowed hygienists to get so that we can practice in other settings other than a dental office. Any type of public health setting we can go into. I got started doing it. It was 2010 that the ADA opened this new certification for us, and I decided that I should get it. I wasn't exactly sure what I was going to do with it at the time, but I felt like it was a certification that I wanted to have. So I got it, and then one day I was cleaning my grandmother's teeth at the dental office where I was working, and she at that time lived at Country Meadows in Hershey. She was in the independent living, but she had had several surgeries, didn't drive, and was in her 80s, late 80s. And my dad brought her in and I cleaned her teeth. And then when she was checking out, she put her head down on the countertop and she was just exhausting. The outing had just exhausted her. And it was then that I realized I can go to her. I can go where she lives. I can clean her teeth in her apartment and she doesn't have to leave and go through this. So I contacted the executive director there at Country Meadows at the time, told him about my certifications, what I could do, would it be okay? Did I have clearance to go in and see her there? And he was, yes, great. Can you see other people here? And I was like, yes, great. So I pretty much started there mostly in their memory care unit. And then it has grown from there. I go all over the state. I have homes in Carlisle and Chambersburg and Ephrata and, everything in between.
So in order to go to all of those facilities, you must have over time developed the same kind of connection with the people who run those facilities. And, this is because it's sort of a development of trust. You are going in to see the people who they care for, and you must develop a level of trust with each person who you come to see. So I'm sure that has taken some time and you've just developed a great relationship all over the place.
Yes, it's slow moving to get the word out. But like you said, it's a trust thing. And I feel very fortunate of the people that I have met, that they do trust me to come in and continue to have me come back. And the word, it gets out. It's a slow process. And unfortunately, oral hygiene is the thing that drops off. With all the personal care. It's I think probably the most difficult thing to get to and an easy thing to let slide. Because of that, it's important for me to be able to get in there to see these people. But I'm very fortunate for the level of trust that people put in me, both not just the facility itself, but the family members that trust me to come in and see their loved one.
And it must be a real relief for not only the patients, but also the family, because of exactly what you described with your grandmother's case, where it was just exhausting for her. And I can think of several clients at Keystone Elder Law where it wouldn't even get to that point because they can't, the mobility just becomes so limited that it's impossible to go to an office visit. And I think that another issue too is as dementia progresses, unfortunately, there can be confusion issues with going outside of a known environment and going somewhere else. So I can think of a number of reasons why your service spares the patient all kinds of trouble, either physical or mental. Has that been your experience?
Definitely. A lot of times when I'm seeing somebody for the first time, one of the things the family says is, I'm not sure how they're going to respond because the last time I took them out, they didn't do well. And because they're in the comfort of their home, their apartment, their room, their place where they're comfortable, because I come in there, it's alleviating stress for the patient. It's alleviating stress for the family. And it's allowing that patient to maintain a level of independence, but the familiarity of their home and the comfort that they feel there, the fact that I can do it there just makes it so much easier. And I very rarely have any difficulty in getting the job done. And I think that has a lot to do with it.
I'm glad you mentioned too that when someone is in an independent or assisted living or personal care facility or even a skilled nursing care, that dental health, oral hygiene can drop off. It becomes somehow justified that that can go by the wayside because they are addressing other needs. But it's, you know, I read a little bit on the CDC website and some other websites before we started this conversation that there's a real risk factor for older adults, especially as they go into more institutionalized care, which they very much need for certain conditions, but they're a risk factor in terms of their dental or oral hygiene because of what you just said, that it's allowed to slide. It's just harder to get those services. And I think people justify, well, that's just my teeth. But I'm sure you would agree that, you know, the oral hygiene is connected to, and dental health is connected to all other health, and there's no compartmentalizing it. And so I think that it's a mistake for people to assume that it can slide by or it's somehow secondary to everything else.
Yes, and I could go on for a long time about this one, but I'll try to keep it basic. Like you said, most people don't understand how incredibly important the oral hygiene is. There's a direct oral systemic link for so many diseases, and research has proven that the condition of your oral health is linked to your overall health. You know, bacteria in the mouth not only causes decay and gum problems, but it's been linked to higher incidence of pneumonia, heart disease, stroke, arthritis, difficulty regulating blood sugar levels in diabetics, weakened immune systems, and just so many other things, so many diseases that you just don't even realize that, hey, that can be exacerbated by bacteria in my mouth. I forget what I was going to say.
Well, I was reading a little bit about how just to sort of add on to that neglecting oral hygiene will lead to this bacteria, which is then connected to other conditions. But a lot of people don't envision also the consequences of certain medications that are absolutely necessary, including those for dementia, that are linked to dry mouth, which then is linked to increased cavity problems, or at least a vulnerability to cavities. And I just think that there's that then in turn, there's all these sort of rippling, cascading consequences. If you are missing teeth or you lose teeth, that could affect your nutrition. So it just seems like there's all kinds of consequences other than just the straight direct link of the bacteria to a specific disease process.
Correct. Yeah. There's most medications cause dry mouth. I don't understand it. It's crazy. And it's amazing the difficulty that dry mouth causes, not just in your swallowing and talking and eating, but in increase of, like you said, you can start to have your teeth break down. You will build up more tartar, get more definitely more cavities. And a lot of times with our patients in memory care, they can't really explain to you that they have a toothache, or that something in their mouth is bothering them. And you might see, oh, well, she's not eating. Well, why isn't she eating? And it could easily be that maybe she just has dry mouth, maybe she has a cavity. So, it's nice to be able to at least see, okay, is the mouth okay? Then we can look at something else. And if it's not okay, well, now we know the problem and we can fix it. And, it's just so important to, keep an infection-free mouth, just for a healthy body, healthy mind, and a better quality of life. And that's my goal, is to help our seniors have a better quality of life in their the final years of their life. And by doing that, by helping them have a germ-free mouth.
Absolutely. And what you just said triggered another question in my mind, which is, if you have people who are in memory care and they don't, they can't remember if they flossed, today, yesterday, and so they become a little more staff reliant. And of course, the staff wants to serve the same goal of a better quality of life. And I'm sure they are, thrilled to see that you come in and provide your services. But do you in any way educate or train the staff in how they can, or what they can be helping with between your visits? Because if flossing and brushing have to happen every day, so you can't see these people every single day. So do you train the staff or work with them to have certain habits in place, especially for those who have memory care problems?
Yes, I definitely do. So I have three types of services. So I have clinical services, where I come in, I do the cleaning, the scaling, the polishing. I have a cordless handpiece, so they get everything they're going to get when they are at the dentist. I do a periodontal check, I do an oral cancer screening, and the appointments last about 45 minutes, but I adjust according to what the patient will allow. If a patient's not having a good day and lose interest halfway through, I stop. I make a note in the patient's chart, let the family know, and the next time I start on the other half. And then there's times when the patient doesn't even want anything done, and then I just sit, talk with them, visit with them for a while, and then leave. I also do educational, in addition to the clinical. So there's two different types of education I do. I do one that is a program that's intended for the residents. So it's a group setting of residents in the community. It's about a half an hour to 45 minutes long. And that pretty much depends on the interaction that I have with the people that are there, what kind of questions they have. It provides information and instruction on brushing and flossing, care of dentures and partials, detailed information on the oral systemic link that we touched briefly on. I go into that in a little bit more detail. And I talk about just medical conditions and little things to look for, tricks if you're having trouble brushing, how to get around that and what to do. And then finally, going to what you directly asked me, is the staff training. I do offer a 1 hour long education program that's designed for the workers, the staff there, especially the personal care assistants. I talk to them about the anatomy of the mouth and why somebody would be having some sensitivity. I talk to them about the balance of oral hygiene, instruction on brushing and flossing, how to do it for somebody else, little tricks to get into somebody's mouth when they don't want you to. There's just these tiny little tricks that you can use to get somebody to open, and so you can get the toothbrush in there. I talk about causes of tooth sensitivity and treatments for it, dry mouth and treatments for it. I also talk a little bit about oral lesions, what to look for, and obviously I can't train them on what's just like a regular ulcer and what's an oral cancer lesion, but the main thing I try to tell them is, okay, if you see a lesion, if it's still there in 2 weeks, refer them out, have somebody look at it. And I'd like to put this out there, I always start my staff training by thanking the staff for what they do. because I am just amazed at what nursing home staff members do. They work hard, they are caring and loving, and what they give our seniors, I'm just so thankful for that. So I try to always start with that because I am very thankful for what they do.
I'm so glad you mentioned that because, you know, we're recording this conversation in the spring of 2020 when it's not easy to be working in that line of work. I think they're put in a hard spot. They're, you know, a lot of eyes are on them and scrutinizing how they do their job. But my experience has been the same as yours, that I'm blown away by the level of commitment and compassion that somebody has who chooses to go to work in that environment. It's truly like a calling for a lot of them, and it really shows. So I'm sure you could speak at length about every one of those topics that you just mentioned and how incredibly valuable for the staff and the residents to hear all of that information when you do the educational piece. But I want to be respectful of your time, and I'd be happy to have another conversation in the future about specific tips or tricks for older people to maintain oral hygiene. But in the meantime, where can people go to learn more about your visiting Hygienist and the services that you offer?
Okay, I do have a website, and that website is www.yourvisitinghygienist.com. And you can also call me or text me or email me anytime. My phone number is 717-580-0467. My email address is cheryl@yourvisitinghygienist.com. Put that up there so people can see it in probably there. And you can make appointments those ways too. I do individuals contact me, individual families contact me, facilities contact me. It depends on, you know, what you want. You can call, text, email, anything to make an appointment at any time. I don't have set hours, so I try to work when it's convenient for the individual. So if I'm making an individual appointment with a family member, I usually ask them, what's the best time of day for, you know, your mom? Are they better in the mornings? Are they better in the afternoons? Right before lunch, right after? It doesn't matter. I will go in when it's easiest for them, when it's best for them. And then I also do clinic days at some facilities, some communities. So if a community wants me to come in and see several patients in a day, we just set up a day and I go from room to room and see whoever they have listed for me to see that day. So I can do it either way, and I do it both ways, either or.
That's great. Thank you so much for the time and for explaining this valuable service. I think you really are adding quality of life and preventative health care that goes a long way for people. So thank you for joining me.
Thank you. I appreciate it. And seniors are my passion, so I am happy to do this.
Whoops.